Hello, everybody. I am so very excited to be speaking with you about a topic which is incredibly close to my heart. Birth trauma and perinatal trauma are extremely common events. What I think is really powerful is just how little we speak about it, even though it's incredibly common. People often ask me about the 30% of women who have or experience birth trauma. And when I think about the number 30%, I think about the fact that that's a reasonably low number of women compared to the 70%. But I feel like most women don't acknowledge their birth trauma. They don't acknowledge that as a bad experience. And do you know why I think that? I think that's because we are taught that childbirth is crap. We're taught and we're told that it's going to be an awful experience. And so when we have an awful experience, we assume that that's just normal and that everybody has a horrible experience. And so why should we be any different? Well, not everybody has an awful experience, and birth is not meant to be an awful experience. Birth is meant to be a transformational experience, but it does not have to be awful or traumatic or horrible, even whilst it's painful. And for some women, it's not painful at all. But that is not what determines a good or a bad birth. The pain of birth goes away. The physical pain of birth goes away. How we're treated during birth and the emotions that we experience during birth, they can stay, and they can stay for a very long time. So whilst we are culturally conditioned to think that birth is just awful and so we should just get on with it, that's not actually how it's meant to be. And so if you have feelings around your birth, whether you are the birthing woman, whether you are the partner, the dad, the mother, the attending midwife or doula or other birth professional, if your feelings around birth are not satisfactory, if they're not joyful, if they are not filled with love and good memories, then I invite you to reach out and have a chat to me. Let's see if what I do can help you take the emotional charge out of that experience, the negative emotional charge. We want the positive emotional charge. We want you to be able to look back on that experience and think about it with joy. We don't want you to get to your child's first birthday and say, oh, I can't even go there. I can't even think about that experience because it's just too much. We don't want you to watch television shows and feel like you can't watch a birth scene no matter how scripted it is because it triggers you. Reach out. Let me help you if you're in a position where you would like to break free from that. I look forward to connecting with you. Bye for now.